Namaskar and a very warm welcome to everyone joining us this afternoon. I wish you all a very happy Navratri, a time when we celebrate the power and strength of the divine family. As we worship the nine forms of Goddess Durga, each symbolizing courage, compassion, and protection, it is also a powerful reminder to safeguard and empower the health of women in our families and communities. Today's webinar, Empowering Women Against Cancer, Myths, Facts, and Screening, is a part of the national campaign Swasth Nari Sashakt Parivar, launched under the visionary leadership of our Honorable Prime Minister Shri Narendra Modi ji. This initiative also aims to raise awareness, promote early screening, and encourage preventive measures so that every woman can lead a healthy and empowered life. This campaign carries a powerful message that the health and empowerment of women are the foundation of strong families and a stronger nation. I am Dr. Vanna Chawla and I have the privilege of moderating this important session today. We are joined by a distinguished panel of experts who will help us understand how awareness, early detection, and myth busting can truly protect women against cancer. To set the stage, it is my privilege to introduce Dr. Shuchin Bajaj, founder director of Ujala Cygnus Healthcare. Dr. Bajaj has been a tireless advocate for equitable healthcare delivery, especially across Tier 2 and Tier 3 cities, and has consistently championed women's health as a national priority. Although Dr. Bajaj is currently traveling and in Geneva, and due to the time difference, he could not join us live today, he has kindly shared a special message for this session. We deeply appreciate his support and vision. Let's listen to Dr. Bajaj's message.
Namaskar and a very good afternoon to everyone. It is truly my privilege to join you, even if virtually, for this very important webinar on women's empowerment against cancer, myths, facts, and screening under the Swasth Nari Sashakt Parivar Abhiyan that we have been carrying out. This campaign carries a very powerful message that the health of women is not just about individual well-being, but about the strength and the progress of the entire family, the entire community, the entire village, the entire nation. So, one of the greatest threats to women's health today is cancer. But the good news is that with awareness, timely screening, and early diagnosis, we can definitely defeat this disease. Cervical cancer, for example, is completely preventable through a simple vaccine and regular pap smear screening. Breast cancer, if detected early, has a survival rate of more than 90%. And of course, Dr. Shalabh sir is here today and he will tell you much more about it. But unfortunately, in spite of these encouraging statistics that I'm telling you, many women lose their lives because of late detection, myth, stigma, or fear. So, together we must break these barriers. We must show the community that cancer is not a curse, nor is it a punishment. It is a disease like any other disease. And with modern medicine, it can be prevented, detected, and treated. Very effectively, all three things can be done. So through this campaign, we are taking the message of awareness and screening to every corner of India, especially Tier 2 and Tier 3 cities and rural areas where women often suffer in silence. I urge all daughters, sisters, mothers, wives listening today, please do not ignore your health. And I really thank Dr. Vanna for organizing this because this is very close to my heart. I appeal to every father, brother, husband, please encourage and support the women in your families to undergo screening, because when women are healthy, the whole family thrives. So let us pledge today that we will replace fear with knowledge, stigma with support, and myths with medical facts. Together we will build a future where no woman loses her life to a preventable cancer. Thank you very much and best wishes to all of you for a successful session, and really thanking all the team members and all the Ujala Cygnus family who have come together to celebrate this Swasth Nari Sashakt Parivar Abhiyan with such great success. I'm really looking forward to the next 2 days. Thank you very much once again. Jai Hind.
Thank you, Dr. Bajaj, for that inspiring keynote and continued commitment to advancing women's health. You reminded us that the fight against cancer truly begins with awareness and early action. Now, to bring in the oncology perspective, I now have the pleasure of inviting Dr. Shalabh Arora, a highly respected medical oncologist who has been at the forefront of cancer care and awareness. Dr. Arora brings with him a wealth of clinical experience and deep insights into cancer prevention, early detection, and treatment. We look forward to hearing his expert views on how timely intervention and collaborative efforts can make a real difference in reducing the cancer burden in our country. Dr. Arora, we look forward to your thoughts. Over to you.
Yeah. So, first of all, many thanks to Dr. Vandana for organizing this unique platform. And as we just heard, Dr. Shuchin, how cancer is now it's a very prevalent disease, and as at Ujala Cygnus, I'm proud to be part of this team who have taken cancer treatment to the peripheries, and even the small centers are now able to access the cancer treatment, which was until now only available in big cities. So just allow me to share my screen. I want to shed some light on breast cancer specifically, because as we know, it is the most common cancer right now in the world. And what actually hurts us the most is when ladies come with breast cancer, advanced breast cancer, because specifically this cancer is a surface cancer. For example, अगर हम बोलें कि किसी के अंदर पेट में हो, which you are not able to feel, you're not able to see that cancer while it's growing, that's still okay, you can't do much about it. But this is something that's right under your eyes, you can feel and you can detect this early. So a small initiative towards awareness about this cancer. Just allow me to share my screen. And so basically we'll briefly go over breast cancer, and since it is the most common, I chose let's just focus on this one particular type. And so first of all, let's understand what exactly is cancer. So we know that our body is made of lakhs and crores of cells, and normal cells have a very controlled growth pattern. But what exactly is cancer? Basically, it's an uncontrolled growth of abnormal cells, because हमारा जो body में cells divide होते रहते हैं, there's DNA damage that occurs at every step, but body has a mechanism in place whereby if there is any DNA damage, either the body repairs it or the cancer cell, if it is not being repaired, it gets killed by the body's immune system. But once in a while, this cell actually evades this response, and abnormally the cell grows on to become a bunch of abnormal cells. It keeps spreading all through the body, and in short, this is cancer. So firstly, let's take a look how common it is, breast cancer. So this is data from 2020 WHO, and if the countries that are marked in pink, they have breast cancer as the most common cancer in their country, both sexes combined. And if you see, almost 159 countries have breast cancer as the most common cancer. In India, basically, we have close to 2 lakh new breast cancer cases every year. And second, there's cervix cancer, which is still a major challenge for most of our patients who have not received vaccines for cervical cancer prevention. And breast cancer, at this point, it accounts for around 1/3 of all cancers in women. And one woman is diagnosed with breast cancer every 4 minutes, and one woman dies of breast cancer every 13 minutes. So compared to the Western countries, where the breast cancer generally occurs in the age group of 60 to 70, here in India, we see that there's a spurt in the age group of 30 to 50, and a lot of our patients are younger. And hence we should be focusing on this age group, that they be aware and they can detect their symptoms early. So first, let's look at the risk factors of breast cancer. There's this around 10-12 risk factors that have been identified. Increasing age, if you have a genetic history or a family history, there's some history of radiation exposure, women who have dense breast tissue, women who are obese, who have high alcohol consumption or red meat consumption, early menstruation or late menopause, basically your menstrual cycles are more than the average, or if you don't have children or you have children at a little higher age. So these are risk factors for breast cancer. And if you see, out of these, the ones that I have marked in green are the ones which are largely within our control, whereas the other factors are not in our control. You cannot control your genes, you cannot control your menstruation when you start or when you stop your cycles. So these are the only modifiable risk factors that we have in our hand. So what the ladies can do to reduce the risk of breast cancer is to limit alcohol consumption, absolutely quit smoking. It's not only about breast cancer. Smoking has a lot of health hazards, cancer, heart, kidney, a lot of ways. Most importantly, you have to stay physically fit. You have to take some sort of physical exercise program, have a healthy and balanced diet, and control your body weight. Then there are options of breast cancer screening, which above the age of 45, once in 2 years, you have to go for a mammography. We'll talk a little bit about this. And for a country like ours, where resources are often a constraint, it's very simple is to do a careful breast examination every month. Basically, because of hormonal changes, ladies can have some lumps in their breast, which are minimum at the time of menstrual cycle. So it's very important that when you are menstruating the first 3 to 5 days, you should palpate, you should feel for your own breast. If you feel any lumps or any abnormal signs, you have to immediately get yourself tested. So it's important to remember that early detection is the key to cure. And first myth that we often have our patients come to us कि cancer से कभी कोई ठीक नहीं होता है, should we even be bothered to treat it? So basically, if we talk about breast cancer over the past few years, you see the cure rates is in the stage 1 is almost close to 100%. Same cancer when it goes down to stage 2 around 90%, stage 3 around 80%, and in stage 4 around 30%. So you see, it's got a lot to do with the stage at which you diagnose these patients. Unfortunately, 2/3 of our patients in India come to us in the 3rd or 4th stage, where our cure rates are low. So like I mentioned, you should self-examine your breast regularly. If there's any lump or nodes, you have to be very careful about them. What are the signs and symptoms? If you notice any nipple inversion, any bumps, any changes in size or shape, if there's any skin changes or any discharge, or you see any blood vessels that are more prominent than they usually are, you should definitely get yourself checked. And if you are above the age of 45, a mammography should be done, which is a very simple investigation. Basically, between two X-ray plates, it's sort of an X-ray of the breast, and this can detect a tumor in very early stages. Even a 5 millimeter tumor can be easily picked up, and a lot of patients who would otherwise come later, they can be detected in the very first stages and can be totally cured of their cancer. Another myth we commonly hear is patients, when we suggest a biopsy, basically if we find something suspicious on your scan, we want to do a needle test to confirm whether it is cancer or any other problem. So when we suggest a biopsy, some patients are very hesitant. They say, biopsy karne se cancer फैल जाएगा. So this is a very common myth that a lot of patients have. And biopsy it's just a simple needle test done to confirm whether the lump that we saw on a scan or you felt, whether that is cancerous or it's a normal lump, and if it's cancerous, what type of cancer it is. So we can't really start treating breast cancer without knowing whether it is cancer in the first place, and if so, what type. Then again, like I mentioned, there's no point getting treatment for breast cancer. You'll anyway die. A lot of people come with this negative outlook. But if you see the average survival of breast cancer, the long-term survival has gone up significantly over the past 4 to 5 decades. In around 70s, you see only around 50% women were able to have a normal life, a 5-year survival. But now, since we have a lot of new therapies that have come into the picture, now the survival has gone up to close to 85 to 90%. Should you be diagnosed with breast cancer or any cancer for that matter? What are the treatment options? We have, if it's a localized cancer, we have to often undergo surgery or radiation. For patients who have cancer that has spread out, hormone therapy, chemotherapy, or targeted therapies are available. So I think I would stop sharing my screen and back to Dr. Vandana. If there are any questions, I'll be very happy to take.
Thank you so much, Dr. Shalabh. So far there is no question in the question and answer chat, as we have just started the session. Thank you so much for the clear and compassionate perspective. And your words remind us that timely detection and modern therapies can significantly improve both survival and quality of life. So I'll get back to you if there are any questions. And thank you so much for joining in between, keeping your patients on hold in OPD and joining this session. Carrying this forward, I'm delighted to welcome Dr. Neharika Malhotra, a leading IVF specialist whose expertise bridges reproductive health and preventive care. She will share insights on the role of regular gynecological checkups, addressing myths about fertility and cancer, and empowering women through open conversations in clinical settings. Over to you, Dr. Neharika.
Thank you so much, Vandana, and thank you to the whole Ujala Cygnus team for doing such a wonderful program on common cancers and their awareness. It's such a need of the hour right now. We have to understand, and if we don't have the knowledge, we sometimes actually miss diagnosing or even miss going to the doctor at the right time. Yeah, I'll be discussing on awareness on common cancers in females. Most common cancers in females is breast cancer, as we just heard. It's cervical cancer, skin cancer and colorectal cancer. So ये चार जो cancers होते हैं, हम इनके बारे में discuss करेंगे आज थोड़ा थोड़ा. We know cancer जो है कि it is one of the leading cause of death in females worldwide, and somehow early detection and awareness is a little poor. जब WHO came with cancer awareness, they made different colors with different cancers. So as you can see, these were the ribbons which came to us. हर कैंसर का एक रिबन अलॉट होता था एंड उसकी थीम पर कैंसर अवेयरनेस by doctors करी जाती. आजकल it's become so common. Every household has cancer. If you talk to any family around you, you will know that there is some cancer in that family. Why is it really happening? Let's ask ourselves some questions. Can our daily choices increase the risk of cancer? आप कुछ ऐसा अपने घर में कर रहे हैं जिससे आपको कैंसर हो सकता है? क्या आपका लाइफस्टाइल आपके कैंसर के लिए रिस्पॉन्सिबल है? आप क्या खा रहे हैं, कितना एक्टिव हैं, कितना आपको स्ट्रेस है? ये सब आपके लॉन्ग टर्म हेल्थ को डिटरमाइन करता है. जैसे कि हमसे पहले सर ने बताया कि कैंसर एक प्रोसेस होता है जो आप ही की बॉडी के सेल्स अनकंट्रोलेबली ग्रो करने लग जाते हैं, रुकते नहीं हैं, उससे कैंसर डेवलप हो जाता है. ब्रेस्ट कैंसर जो मोस्ट कॉमन कैंसर इन फीमेल्स है, जो इजीली विद सेल्फ एग्जामिनेशन एंड मैमोग्राफी प्रिवेंटेबल है. सो अगर आप एक महिला हैं और 35 इयर्स से ज्यादा हैं, तो आपको रेगुलरली सेल्फ ब्रेस्ट एग्जामिनेशन करना चाहिए. हमारे कंट्री में ब्रेस्ट कैंसर बहुत हाई है. Almost 30% females are suffering for some form of breast diseases. So we have to understand about breast cancer. क्वेश्चन आता है, अरे ये तो सिर्फ उन्हीं को होता है जिनकी माँ या बहन को कैंसर है. ऐसा बिल्कुल भी नहीं है और ये बहुत बड़ा मिथ है. अगर आप ये पाई चार्ट देखेंगे, 100 ब्रेस्ट कैंसर्स होते हैं तो उसमें से 10% ऐसे होते हैं जो जेनेटिकली ब्राका जीन से आते हैं. 25% ऐसे होते हैं जिनमें कोई फैमिली हिस्ट्री होती है, लेकिन 65 ऐसे होते हैं जिनमें कोई हिस्ट्री नहीं होती. इसीलिए ये किसी को भी हो सकता है. एंड ऑल ऑफ अस एज फीमेल्स should know the breast self examination, जो सर ने हमें अच्छे से समझाया, should be done during or immediately after your periods. आप बैठ के या लेट के सेल्फ ब्रेस्ट एग्जामिनेशन करते हैं और कहीं भी आपको कोई भी abnormality, lump या स्किन पे चेंजेस मिलते हैं, तो you should go to a gynecologist and get yourself a clinical breast examination done. अगर हमें क्लिनिकल या सेल्फ ब्रेस्ट एग्जामिनेशन में कोई डाउट होता है तो एक मैमोग्राफी करी जाती है. मैमोग्राफी एक एक्सरे होता है आपकी ब्रेस्ट का, जो हमें बताता है कि कोई रिस्क फैक्टर है कि नहीं. उसके साथ साथ हम एक अल्ट्रासाउंड भी कर सकते हैं जो कि डायग्नोसिस में हमारी हेल्प करता है। ब्रेस्ट कैंसर प्रिवेंटेबल है, टाइमली ब्रेस्ट कैंसर से 100% क्योर हो सकता है। इसीलिए इट इज वेरी इंपॉर्टेंट टू फॉलो द 3 पिलर्स। फर्स्ट इज हेल्थ प्रमोशन, avoiding obesity, limiting your alcohol intake and encouraging breastfeeding in females. दूसरा, timely diagnosis. Self breast examination and clinical breast examination will help us in timely diagnosing and of course timely treatment. Second important cancer जो I think we all should know is cervical cancer. हमारी जो यूट्रस होता है वो इस तरह का दिखता है, अगर आप मुझे देख सकते हैं, ये हमारा यूट्रस है। ये यूट्रस के जो बच्चेदानी का मुंह होता है इसे हम सर्विक्स कहते हैं। ये जो कैंसर होता है ये हमारी कंट्री में बहुत तेजी से बढ़ रहा है। सर्वाइकल कैंसर HPV वायरस के इन्फेक्शन से होता है और अभी हमारे पास ऑलमोस्ट 15 to 20 हाई रिस्क टाइप्स ऑफ वायरसेस हैं जो एसोसिएटेड विद कैंसर हैं। अगर आप आंकड़े देखना चाहेंगे तो देखिए कि कितना इंक्रीज हो रहा है सर्वाइकल कैंसर का डिजीज बर्डन इंडिया में। और जैसे कि मैंने बताया HPV 16 और 18 जो है वो सबसे ज्यादा हाई रिस्क फैक्टर होता है सर्वाइकल कैंसर के लिए। ये कैसे होता है? सेक्सुअली ट्रांसमिटेड होता है, कई बार मदर टू चाइल्ड भी हो सकता है। कौन सर्वाइकल कैंसर के लिए रिस्क पे होता है? पहला, अगर आप यंग एज पे सेक्सुअली एक्टिव हैं तो। दूसरा, अगर आपके मल्टीपल सेक्स पार्टनर्स हैं। तीसरा, अगर आपके पार्टनर में कोई हिस्ट्री ऑफ मल्टीपल इन्फेक्शंस है। और एडेड चीजें जैसे कि स्मोकिंग, लॉन्ग यूज ऑफ ओरल कॉन्ट्रासेप्टिव पिल्स एंड न्यूट्रिशनल फैक्टर्स। अर्ली सर्वाइकल कैंसर के कोई साइंस नहीं होते, इसीलिए स्क्रीनिंग बहुत बहुत जरूरी होती है। और अगर आप 35 से ऊपर हैं तो आप एक रेगुलर गायनेकोलॉजिस्ट चेकअप के लिए जरूर जाएं। स्क्रीनिंग एक बहुत सिंपल टेस्ट के साथ करी जाती है जिसे कहते हैं पैप स्मीयर। पैप स्मीयर में आपके बच्चेदानी के मुंह से एक छोटा सा सैंपल लिया जाता है और उसको माइक्रोस्कोप में एग्जामिन करा जाता है। अगर हम सर्वाइकल कैंसर को जल्दी पकड़ लें तो इट कैन बी सक्सेसफुली ट्रीटेड। इसीलिए स्क्रीनिंग इज वेरी वेरी इंपॉर्टेंट। मल्टीपल ट्रीटमेंट ऑप्शंस हमारे पास होते हैं वंस वी गेट डायग्नोस्ड विद सर्वाइकल कैंसर। सर्जरी, रेडिएशन एंड कीमोथेरेपी। यस, इट कैन बी प्रिवेंटेड और हमें अवेयर होना चाहिए कि ये कैसे प्रिवेंट हो सकता है। सबसे इंपॉर्टेंट है HPV वैक्सीन। अभी कई बार एक मिथ आता है कि HPV वैक्सीन सिर्फ यंग लड़कियों को लगती है, अब हमें नहीं लग सकती, but that is completely wrong. Now FOXI and WHO recommends that HPV vaccine can be given from the age of 9 years to 45 years. So अगर आप में से किसी को भी HPV वैक्सीन नहीं लगी है तो प्लीज HPV वैक्सीन लगवाएं so that आपका रिस्क टू सर्वाइकल कैंसर एकदम कम हो जाए। नेक्स्ट इंपॉर्टेंट कैंसर जो महिलाओं में कॉमन है वो है ओवेरियन एंड एंडोमेट्रियल कैंसर। तो जैसे हम यूट्रस की बात कर रहे थे, ये हमारी ओवरीज होती हैं और जो यूट्रस के अंदर की लाइनिंग होती है वो होता है एंडोमेट्रियम। जो ओवेरियन कैंसर है इसको साइलेंट किलर कहा जाता है और ये 8th मोस्ट कॉमन कैंसर है क्योंकि ये बहुत इजीली डायग्नोस नहीं होता। बट इसके कुछ इंपॉर्टेंट रिस्क फैक्टर्स हैं। पहला, फैमिली हिस्ट्री ऑफ एनी कैंसर। दूसरा, ये ज्यादातर एल्डरली एज ग्रुप्स में होता है। तीसरा, जो बेसिक कैंसर के सिम्टम्स होते हैं, लॉस ऑफ एपेटाइट, भूख नहीं लगना, परसिस्टेंटली ब्लोटिंग होना, अब्डोमिनल पेन होना और बार बार यूरिनरी इन्फेक्शन होना। सो इसीलिए जब भी आपको कोई ऐसे छोटे मोटे सिम्टम्स होते हैं और आप घर में नहीं जाते डॉक्टर के पास तो कई बार आपका डायग्नोसिस मिस हो जाता है। ये डायग्नोस होता है अल्ट्रासाउंड से, एक बायोकेमिकल टेस्ट से और CT या MRI स्क्रीनिंग से। इसको कैसे प्रिवेंट कर सकते हैं? इसको प्रिवेंट कर सकते हैं गुड लाइफस्टाइल चेंजेस से और प्रोफाइलैक्टिक सर्जरी से। मतलब अगर किसी के घर में या महिला में, माँ या बहन को ओवेरियन कैंसर है तो हम आपकी एक प्रोफाइलैक्टिक सर्जरी कर सकते हैं जिसमें आप में ये रिस्क ना हो। एंडोमेट्रियल कैंसर यूट्राइन लाइनिंग का होता है। ये बहुत ज्यादा कॉमन नहीं है बट ये जल्दी डिटेक्ट हो जाता है अगर आप डॉक्टर के पास जाएं। अगर आपको पीरियड्स इरेगुलर हो रहे हैं या पीरियड्स में बहुत हैवी ब्लीडिंग हो रही है, साथ साथ आपको मोटापा है, डायबिटीज है और ब्लड प्रेशर है, ये जो 3 बीमारियां होती हैं ये तीनों बहुत रिस्क फैक्टर होती हैं किसी भी तरह के कैंसर के लिए। डायग्नोस कैसे करा जाता है? छोटी सी बच्चेदानी के मुंह से एक बायोप्सी ली जाती है जो हमें बताती है कि इसमें कैंसर है कि नहीं। प्रिवेंशन इज ओनली वेट कंट्रोल, गुड एक्सरसाइज एंड रेगुलर स्क्रीनिंग। ओवेरियन एंडोमेट्रियल कैंसर्स बहुत मेजर हेल्थ कंसर्न्स होते हैं क्योंकि ये जल्दी डायग्नोस नहीं होते, इसीलिए आपको खूब विजिलेंस रखनी चाहिए, लाइफस्टाइल चेंजेस अच्छे रखने चाहिए, एंड अर्ली कंसल्टेशन एंड टाइमली इंटरवेंशन कैन सेव लाइव्स। लास्ट कैंसर एक और डिस्कस करेंगे, कोलोरेक्टल कैंसर। कोलोरेक्टल कैंसर कोलोन और रेक्टम को अफेक्ट करता है और ये भी कहते हैं महिलाओं में काफी कॉमन है, और ये आपके लाइफस्टाइल और जेनेटिक फैक्टर्स की वजह से होता है। ज्यादातर 50 के आसपास की महिलाओं को ये हो सकता है जिनको बहुत ज्यादा बावल इश्यूज होते हैं और इन्फ्लेमेटरी बावल डिजीज होती है, उनमें देखा गया है कि इसका रिस्क ज्यादा होता है, और जो लोग बहुत कम फाइबर खाते हैं अपनी डाइट में। तो अगर आपको 40-45 के बाद चेंजेस इन बावल हैबिट्स हो रहे हैं, स्टूल्स में ब्लड आ रहा है, अनएक्सप्लेन्ड वेट लॉस हो रहा है, तो आपको इसके लिए चेक कराना जरूरी है। आप कैसे प्रिवेंट कर सकते हैं? स्मोकिंग ना करें, अल्कोहल ना लें, और 45 के बाद रूटीन स्क्रीनिंग के लिए जाएं। स्किन कैंसर सडनली कुछ सालों में बढ़ता हुआ दिखता आया है। स्किन कैंसर इज वेरी वेरी कॉमन नाउ। इसमें क्या होता है, आपके स्किन के जो सेल्स होते हैं वो अबनॉर्मली ग्रो करने लग जाते हैं। कॉमनेस्ट मोस्ट सीरियस टाइप इज मेलानोमा। तो अगर आप बहुत ज्यादा सन एक्सपोजर के साथ हैं और आप बहुत फेयर हैं, उन केसेस में ज्यादा रिस्क होता है स्किन कैंसर होने का। दूसरा, अगर आपको बहुत सारे मल्टीपल मोल्स हैं अपनी स्किन में, आपका इम्यून सिस्टम बहुत वीक है और आपको बार बार सन बर्न्स होते हैं, तो दीज आर ऑल रिस्क फैक्टर्स। इसमें हम एक ABCDE रूल करते हैं जिससे आप याद रखें तो बहुत इजी होगा। कहीं भी स्किन में असिमेट्री या अनइवन शेप है, कुछ इरेगुलर ब्लर्ड एजेस या ग्रोथ है, कुछ स्किन के कलर चेंजेस हो रहे हैं, D से 6 मिलीमीटर से ज्यादा हैं और E से ये बढ़ते जा रहे हैं, ये एक वार्निंग साइंस बताते हैं स्किन कैंसर के। कैसे प्रिवेंट कर सकते हैं? बहुत अवेयरनेस है, सनस्क्रीन यूज करिए। इवन अगर धूप ना हो और आप बाहर जा रहे हैं, सनस्क्रीन लगा के जाएं। प्रोटेक्टिव क्लोथिंग पहने और मंथली सेल्फ एग्जामिनेशन जरूर करें। We have to be aware because awareness will help protect ourselves and our family. एक और कॉमन चीज जो अब देखी गई है, वेरी वेरी इंपॉर्टेंट आप सबके लिए, कॉस्मेटिक्स। सडनली ओवर यूज ऑफ कॉस्मेटिक्स दिख रहा है हमारे कंट्री में, एंड जो कॉस्मेटिक्स में पैराबेन्स या फॉर्मेल्डिहाइड्स या मल्टीपल कलर्ड डाइज होती हैं, उनमें रिस्क होता है कैंसर होने का। तो जब भी आप कोई कॉस्मेटिक खरीदते हैं, आप इसका स्क्रीनशॉट ले लीजिए। ये वाले जो केमिकल स्क्रीन में दिख रहे हैं, अगर ये आपके कॉस्मेटिक्स में है तो प्लीज इनको अवॉइड करें क्योंकि ये डायरेक्टली रिलेटेड हैं कैंसर होने के लिए। दूसरा, बहुत ज्यादा फ्रेग्रेंस वाली चीजें, जो बहुत स्ट्रॉन्ग परफ्यूम्स होते हैं, उनमें भी रिस्क होता है कार्सिनोजेंस होने का, जो कि कैंसर कॉजिंग केमिकल्स होते हैं। हेवी मेकअप ऑल्सो ब्लॉक्स योर पोर्स एंड स्किन, जिससे कि स्किन का जो नेचुरल डिफेंस सन की तरफ होता है वो वीक हो जाता है, सो वो एक और रिस्क फैक्टर होता है। इसीलिए हम लोग कहते हैं कि आप बेसिक गुड क्वालिटी फार्माकोलॉजिकल सनस्क्रीन यूज करें, ना कि जो कॉस्मेटिक सनस्क्रीन्स होती हैं, बिकॉज ये आपके को उतना एडिक्वेट प्रोटेक्शन नहीं देती। स्किन कैंसर प्रिवेंटेबल है, ट्रीटेबल है। Protection for your skin from UV rays of the sun is very very important. Awareness is the first step to prevention. Please choose paraben free good quality cosmetics when you apply. Always apply a sunscreen whenever you go out, and give your skin makeup free days so that your skin has time to breathe. All these cancers you can reduce your risk by only some small lifestyle changes. स्मोकिंग अवॉइड करनी है, पर्सनल हाइजीन रखना है, वैक्सीनेट करना है अपने आप को, फिट रहना है, हेल्दी खाना खाना है, अल्कोहल इनटेक नहीं करना है, सनस्क्रीन यूज करनी है और एनुअल हेल्थ चेकअप जरूर कराना है। सो विद दिस माय टेक होम मैसेज इज, you have to be aware so that you can detect cancer early. Screening saves lives. Vaccination can prevent cervical cancer. Healthy lifestyle reduces your cancer risk. women's health is family's health, so they have to prioritize it. Thank you.
Thank you so much, Dr. Neharika, for so eloquently highlighting cancer prevention. Your insights remind us that regular gynecological checkups, open conversations, and preventive screenings are not just medical necessities. They are powerful tools to safeguard women's health and well being. By addressing myths and encouraging proactive care, we can truly make early detection a part of every woman's health journey. Next, I'm pleased to invite Dr. Sudeep Shetty, who will share how early screening programs, community outreach, and family engagement can drastically reduce cancer risk. He will also share inspiring grassroots stories on how caregivers and families play a crucial role in encouraging women to access screening and care. His practical insights will help us understand what simple preventive steps women can take today to safeguard their health. Over to you, Dr. Shetty. Please go ahead.
Thank you. Thank you, Dr. Vandana. Good afternoon, everyone, and happy Dasra for everyone here. Again, thank you, Ujala Cygnus Group and Dr. Vandana for including us in this webinar, which is very important in terms of this campaign, which is Swasth Nari and Sashakt Parivar, which is primarily focused on women's health for overall family health, community health, and nation's health altogether. So let me share my screen and walk you through some of those experiences what we had. So in first again, Dr. Shalabh sir and Dr. Neharika madam covered most of the clinical aspects of the cancers among women. I will be shortly taking you through the outreach and caregiving support what is required for women. Particularly when we consider the coverage of screening, which is very poor among women compared to men across all cancer conditions. So in next 10-15 minutes, I'll be just touching few of the points like why we require early screening and why we require community outreach as well, and role of families in encouraging the screening program, and certain practical models, training models, which actually helped enhanced screening coverage across multiple locations across the country, and also our Noora health organizations and initiatives in terms of reaching families and caregivers across multiple conditions. Of course, cancer is one of the major programmatic conditions where we are working at present. So as Dr. Shalabh and Dr. Neharika covered, I think the statistics part, which is very important, like 2 cancers again among the multiple cancers among which are called as reproductive cancers again among women, 50% are taken up by breast and cervix alone. This is across multiple states, multiple countries across the globe. Even though the range is from 25 to 65% across different states in India. For example, if you consider northeastern states, which is going for a higher range, whereas in some states in western part of India, it is compared relatively lesser. So there is a tragedy here. Like most of the women cancers are detectable early, treatable, and survival rate is also higher when compared to the cancers among men. But unfortunately, women often present very late. There are multiple reasons. We will just we'll look at it. What are those issues with respect to poor coverage among women, and certain programs where we reached families and communities, where we equipped the families with knowledge and skills that change the behaviors and also improvement in their outcomes. Let's see why this early screening is required. As both the predecessors talked about, multiple cancers, there are screening programs available within the public sector as well as in the private sector. So breast cancer, if you see the self-examination added with clinical examination and mammography, this can detect disease at the earliest time. As Dr. Shalabh said, even less than 5 millimeter of breast cancers can be detected when it is used as a proper screening process. And the survival rate is more than 90% if it is detected early. So That is one of the reasons why screening is required at the earliest stage, so that we can reduce overall morbidity and mortality, and survival rate is almost 90% plus. Cervical cancer, if you take, again, I'm covering only these two primarily because these breast cancer, cervical cancers, and oral cancers, these are common three cancers where even the public health system has free screening programs. So coming to the cervical cancers, again, survival rate is again 90% plus here, and mostly it is treatable with radiotherapy and surgery, whether to when detected in earliest stage. That is a local treatment. With a localized treatment, this can be treated fully so that survival rate is achieved to the maximum. And oral cancer, of course, this is also having diverse survival rate from 70 to 90%. Again, 5-year survival rate is in this range when it is detected at the earliest. So key points is like early screening is not just about the tests, it is about normalizing the preventive care. So thinking that, okay, I'm healthy, why I should go for screening? It is not that. Even if a doctor or some health worker, give a cautions, it helps us to keep back to our track, coming back to our track of preventive healthcare system. And screening programs saves lives, reduces treatment costs. This is for both health system as well as for the patient side. And integrating screening into the primary care at the lowest level of healthcare level and at the community level, that will help the outreach best. As Dr. Shalabh said, now the cancer screening and cancer treatment is kind of decentralized. Maybe if you see 15-20 years back, I think only few tertiary care hospitals used to manage cancers. Now even the block level hospitals, I'm sure Ujala has network of hospitals which takes care of cancer care and screening. So this is how the screening is important. This is something when we talk about screening, again, women's cancer screening, there is a program called National Program for Non-Communicable Disease, where cancer is a part of it. All women aged 30 years and above should be screened for CA breast, CA cervix, and mouth cancer. At least once in 5 years, they should go for a screening and get back to normal preventive care. So, since this is the NFH is the National Family Health Survey, once in 5 years across the country, sampling is taken. So the latest available evidence is for 2020. So as per this data, the cervical cancer screening is only 2%. Breast cancer screening is just 1%. Oral cancer is just above 1%. And overall cancer screening among the population who are supposed to have regular screening is just 5%. So none of the cancers have taken 2 digits in terms of percentage of achievement so far. This is a tragedy. There are various health systems available, and there are various, even including the national programs, have free screening services. Even with this, our coverage has not gone beyond 5%, particularly the breast cancer and cervical cancer in just 1 and 2% respectively. This is something alarming for us. So now the question is, why this screening is so low? There is a diverse factors affecting this. So now coming to the knowledge and awareness. First of all, there is low awareness. What is cancer? What are the risk factors? Am I vulnerable for cancer? If so, where I can go, and what are the schemes available for us? Nothing is known to us. That is one of the major gap in terms of awareness. Misinformations, mostly the false beliefs. Oh, cancer, that is a dead end of my life. I am gone. The such kind of misinformations. And understanding of risks. Even going to a screening, even though there is a screening camp is conducted in certain outreach areas, still women will not turn up. The reason is there is overdiagnosis, what to do with the risk associated with certain screening programs. These are the issues against which there is a lack of knowledge and awareness, based on which there is a poor coverage. Coming to the psychological and social barriers, there's a fear and stigma. Even if I want to see a breast, who will marry me? Who will marry my daughter? So let us don't get into this business at all. And embarrassment, shyness. getting into a screening clinic where even if it is a male doctor, even if there is a female doctor, there is a certain kind of shyness, embarrassment, particularly when we talk about women's reproductive cancers. And discrimination being a female, of course, I even though there are certain evidences literature says about it, I mark it as red because I don't think health system will treat a woman to that level, even if there are few sporadic cases may be happening, but I don't agree with this, but I have to mention it because it is in the literature. So loss of sexuality. There is a misconception that getting into a screening program will affect the sexuality and affects the virginity of a person. So that is another factor. And access to healthcare. Even if I want to get into a screening camp, I don't have resources or money or other services and facilities to get into the screening program. And geographic location, of course, it is far away. It is 65 kilometers from my place. I can't go alone and come back. And other factors, of course, disability and mental health, when it is affecting women, that is also one of the hindering factors for getting to the screening process. Family and cultural norms, various cultural beliefs that cancer there is nothing like cancer, and you don't have to get into this screening. There is a God for us to help. Lack of provider communications. This is another thing, like even in the periphery we see, even about the national programs, even if there is a free screening, the information may not be disseminated across households. That is another communication related issues with respect to screening. Why community outreach programs? When I talked about, when Dr. Vandana said about community outreach programs, of course, this is one of the easiest intervention where we can sensitize the woman in periphery and make them as a denominator for our screening. So this community outreach program increases the awareness and knowledge. It reduces the stigma and fear. It builds trust in the healthcare system. It is not like, okay, the tertiary, cancer care is only for the rich people, affluent families, only in the tertiary care hospitals. No. Now it has decentralized to even at the primary care level, certain screening processes are made available. So this actually helps in building trust. Increases accessibility. Again, the outreach programs will make people to get into the camps, screening camps easily, even though there are other constraints available. So this would be addressing that. Engage families and caregivers. This is decision makers at home to support women's participation in screening. That is, family involvement is one of the most important when I keep stressing on this. And encouraging behavioral change, enable early detection and better outcomes, empowers women and communities. So this is how we can reach women at the peripheral part so that screening denominator can be further enhanced. Now coming to the families, role of the families in cancer screening. So women often prioritize family needs over their own. That is one of the reasons. I don't get anything, I have to work, my family should be fine. That is the only motto of our Indian women. That is why they struggle from day and night for keeping the family happy and prosperous. So giving caregivers, when we talk about who are the caregivers for them, husbands, children, sister-in-laws, mother-in-laws, even though they are elderly. So they need to act as a caregivers at certain point of time. These people play a decisive role in the woman seeking a screening process. Family encouragement is often tipping point here. Example is like, for example, a family member can remind a woman to get into a best screening follow-up visit or a screening camp related activities. And families ensure women do not miss annual checkups. For example, we celebrate birthdays and other things with cakes and other things. It is better to get into a health checkup on our birthdays annually, at least once in a year, so that this can be addressed. Family can help in such kind of rewarding in terms of sensitizing the woman in getting into the screening or health checkups. Caregivers also caregivers also the key people in breaking myths, because certain myths like screening will cause cancer, pap smears are shameful kind of things. I think families have a key role in making women to break these myths. And Again, I will be covering about our program in subsequent slides. And there are a few models of outreach, what we have seen in our experience and also what we are doing at present in Noora Health. One is peer-to-peer training module. For example, there are certain examples. I'm just putting few examples across the country here. One is Kudumbashri in Kerala, the first graphic what we see, like women self-help groups were trained on cervical cancer and passed on knowledge during weekly self-help group meetings, leading to higher screening coverage. This has shown that such kind of peer-to-peer training model has increased the coverage. And there are a few examples similarly like SEWA, that is Self-Employed Women's Association in Gujarat, as well as contemporary programs in Jharkhand. They have increased to a certain extent that increase the screening programs. Survivor-led storytelling and training. This is another thing like one example is the Umeed project in Maharashtra in Mumbai, where the Tata Memorial Hospital had supported a kind of bringing the survivors of the cancers and making them as a trainers in certain slum areas in Mumbai where the outreach program had been taken up. So similarly, there are We Care Foundation is another similar program like where survivors were being used as trainers to sensitize women on importance of cancer screening. And there are certain conferences also happening for the survivors, which is also a kind of advocacy for screening activity. And participatory theatre and folk media training. This is again, I think this is one of the graphic what you see in Chennai and one in Assam, where certain theatre activities actually helped sensitizing the cancer screening activity among women particularly. School and family awareness training. This is again HPV related cancer awareness program. Again, cancer sensitization, including immunization promotion activities. Mobile camps and on-the-spot training. Again, I'm sure maybe I think Ujala Cygnus also has this activity. There are various tertiary care hospitals, their societies, and including the government programs where there is outreach mobile camps and also the screening plus on-the-spot training to the community on sensitizing them to get into the screening. And community champion and influencer training. Again, the one graphic what you see on the left is in one of the gurudwaras where the sensitization training programs being conducted in gurudwaras and even certain religious places where the sensitization on the screening is being done. This is something participatory learning and action, which is popularly known as PLA, where villagers are, particularly the women group, are made to come together and identify the health issues among them and identify the risk factors for that and what action they can take, they will decide, which will be facilitated by the frontline health workers at the field level. In Jharkhand, the Ekjut is the organization which is taking this concept, and Noora Health and Ekjut is also working very collaboratively in Jharkhand and Andhra Pradesh at present on promotion of outreach, sensitization on cancers, including other non-communicable diseases. And experiential hands-on training. For example, hand washing everybody knows, but how a self-examination breast can be done. This can be experiential. It is not just by video or graphics. It is like hands-on training for the women at the outreach facilities, and also certain outreach programs like with the models, with certain models, teaching sessions being taken up by medical students in remote locations. And this is one with the emergence of the digital and technology, digital and WhatsApp micro training in various videos and scanning a QR code and getting into a training sessions once they get into onboarding into this system. And also if they ask any questions on any health related information where the additional information on particular cancer can be given and promoted for the cancer screening. These are the few things again. And coming last point is about our Care Companion program. I just wanted to highlight our experiences and what we do in Noora Health with respect to cancer care. So our approach is this, like we keep the family as the center of our health literacy program, and we have multiple phases or the modes of health dissemination, mainly through the health information messaging system, through the digital technology, as well as using simple tools like flip charts or even handouts kind of thing, and also adding storytelling and adding new analogies for their ease of understanding to this illiterate outreach population as well. And community-driven knowledge, the community-driven change, that is giving knowledge and motivating them, that is a behavioral change, and seeing the action being taken up by the people who are actually taking this knowledge. So this is the process we work along, and this is a cycle we are completing across. And training caregivers as multipliers of awareness. This has to cascade further. So caregivers, once the families are made as knowledgeable people or a group of people who can cascade the information, that is the primary objective of Noora Health. So this is the process, like how we develop any program, particularly in the cancer. If you take example, identify the priority family care practice, develop engaging materials, train the trainers, then who will train the families later? Because Noora Health will not train every community member. We work with the health system, like whether it is a government health system, whether it is a private healthcare services, depending on the audience, profile of the audience of the patients, we develop the programs according to that and we disseminate it. Of course, tech-enabled continued care, even after discharge at the hospital, once they go back, how they will get connected to get some health educational information. And this is the digital mobile care companion service through which we are working at present. And these are the multiple program areas, as I mentioned initially. Of course, oncology care is one area where we are working, apart from which we are in maternal health, newborn health, child health, other NCDs like diabetes, hypertension, and cardiac care, post-surgical, post-interventional cardiology, how to take care of your heart, and HIV care, tuberculosis care. Again, this is mostly we are working closely with the public sector. So these are the different tools I will not take. These are the physical tools apart from the digital tools what we have in terms of videos and WhatsApp connectivity and two-way response where our doctors and nurses respond 24/7. And how do we reach these population? We work in government, the hospitals, the health facilities. We don't want our caregivers who are sitting in veranda and wasting their time. We want them to sit with our health workers in the facilities, and these wards are made as classrooms, and our health workers, they use simple flip charts and simple education materials or models like a breast model, for example, and a thali model, a physical thali model, to show them like what should be the right nutrition for you. So this is how the classrooms are made in hospitals, and the information is being disseminated. And even at the peripheral hospitals, even in the village level, there are community health officers as frontline health workers who also take these sessions to the community elderly population on NCD related conditions, including cancer. And this is, again, as I said, it is a participatory learning and action where villagers themselves, they identify their health issues and they come up with their own solutions and act. So this is a new project which we started this year in Jharkhand and Andhra Pradesh, again against NCDs, including cancer care. And as I said, remote engagement service is through the WhatsApp, and the user can get onboarded through scanning a QR code or dialing a toll-free number, and they get into multiple conditions, whether they want to know more about diabetes or a cancer or any within the cancer, they can ask which cancer they want to know. Even we have two-way response system, as I mentioned. We have, and these are the few snapshots from the flip charts, like the cancer symptoms, symptomology, and how to do a self-examination of breast in terms of infographics. And yeah, this is how we work remotely. Once the user sends a question to us on health information, we are not treating, we are not diagnosing, even though there are specialist doctors working at the back end. We don't diagnose and treat. We give a health informational information or guidance to the patients whenever they require something on any conditions with respect to NCD or MCH or cancer care or cardiology or HIV or AIDS and tuberculosis. So Yeah, and coming back to the cancer, again, these are the last few slides again. In 2018, we started exclusive oncology care companion program in Kidwai Cancer Hospital in Bengaluru. And so far, nearly 4,000 patients have been, and their family members have been trained on cancer care patients. And 2021, we incorporated cancer care into the NCD module. And 2023, we have taken this program into the community outreach. Again, in 2019, we started remote support through WhatsApp education. And 2024, we started our program in Kachar Hospital in Assam, which is exclusive cancer care hospital. This is something NGO kind of hospital where we are working. And 2025, this year, we started participatory learning and action in Jharkhand and Andhra Pradesh. I just wanted to run one of the educational sample video to all of you, like how we are trying to reach the outreach community to enhance.
पर्दे पे तो सब हीरो को देखते ही हैं, लेकिन असल जिंदगी में वो हमारे बीच में ही होते हैं। आज हमें उन्हें सम्मान देने का एक मौका मिला है। उन्होंने न केवल अपने स्वास्थ्य का ख्याल रखने की दिशा में पहला कदम उठाया है, बल्कि महिलाओं को स्तन के कैंसर की जांच कराने के लिए प्रेरित किया है। देखते ही हैं, लेकिन असल जिंदगी में पर्दे पे तो सब हीरो को देखते ही हैं, वो हमारे बीच में ही होते हैं। आज हमें उन्हें सम्मान देने का एक मौका मिला है। उन्होंने न केवल अपने स्वास्थ्य का ख्याल रखने की दिशा में पहला कदम उठाया है, बल्कि महिलाओं को स्तन के कैंसर की जांच कराने के लिए प्रेरित किया है। आप लोग यही सोच रहे होंगे कि आखिर ये है कौन, है ना? हमारे कल्याणपुर की तारा जी और सुषमा जी ने बहुत साहस के साथ स्तन के कैंसर की जांच करवाई है। कृपया आप दोनों मंच पर आएं। तारा जी, क्या आप हमें इस बारे में कुछ बता सकते हैं?
सत्यन, आप बुरा न माने तो क्या मैं पहले बोल सकती हूँ?
बिल्कुल सुषमा जी, क्यों नहीं?
एक दिन मुझे ये जानकर बड़ा ताज्जुब हुआ कि तारा जी ने किसी लक्षण के बिना ही स्तन के कैंसर की जांच करवा ली। अगर उन्होंने मुझे स्तन के कैंसर की जांच के फायदों के बारे में नहीं बताया होता तो मैं कभी भी जांच नहीं करवाती। एक दिन मैंने अपने निप्पल से कुछ द्रव निकलते हुए देखा और मैं नजदीकी अस्पताल गई और डॉक्टर को इसके बारे में बताया। उन्होंने मुझे तुरंत कुछ जांच करवाने की सलाह दी। तभी मुझे पता चला कि मुझे स्तन के कैंसर के शुरुआती लक्षण हैं। जल्दी जांच और इलाज करवाने की वजह से ये शुरुआती स्टेज पे ही ठीक हो गया। अगर ज्यादा देर हो जाती तो इससे जुड़ी समस्याएं बढ़ सकती और इसके लिए मैं तारा जी को धन्यवाद देना चाहती हूँ। उन्होंने मुझे अपने स्वास्थ्य पे ध्यान देने के लिए प्रोत्साहित किया।
धन्यवाद सुषमा दीदी, मुझे इस बात की बहुत खुशी है कि आपने बिना किसी देरी के स्तन के कैंसर की जांच करवाई। हम महिलाएं एक माँ, पत्नी, दोस्त, टीचर, नर्स सभी की भूमिकाएं निभाती हैं। हम घर में सभी का ध्यान रखती हैं, लेकिन हमारा क्या? हम सबकी तरह मैंने भी अपना ध्यान नहीं रखा, लेकिन मेरे पति, मेरे देखभालकर्ता ने मुझे मेरे स्वास्थ्य पर ध्यान देने का एहसास करवाया और मुझे जांच करवाने के लिए प्रोत्साहित किया। तभी मैंने अपना पहला कदम लिया और अपनी जांच करवाई। मैं चाहती हूँ कि आप सब भी इस ओर कदम बढ़ाएं और अपनी जांच करवाएं। स्तन का कैंसर महिलाओं में होने वाला सबसे आम कैंसर है। इसके लिए हर महिला को महीने में एक बार अपने स्तनों की जांच करनी चाहिए। सपाट हाथों से स्तन को दबाएं और इन लक्षणों पर ध्यान दें। स्तन या बगल में सूजन होना, स्तन की त्वचा पर गड्ढे या सिकुड़न होना, स्तन के आकार, आकृति, रंग और त्वचा में बदलाव होना, स्तन में कोई स्राव या दर्द होना, अचानक वजन कम होना। अगर आपको इनमें से कोई भी बदलाव या लक्षण दिखाई दे तो नजरअंदाज न करें, देर न करें। आपको तुरंत नजदीकी सरकारी अस्पताल में जाकर डॉक्टर से बात करनी चाहिए। वो जो भी सवाल पूछे उसका बिना किसी हिचकिचाहट के सही जवाब दे। किसी भी सरकारी अस्पताल में इसकी जांच और इलाज मुफ्त है। आपकी लापरवाही स्तन के कैंसर का कारण बन सकती है। 30 की उम्र के बाद हर 5 साल में एक बार स्तन के कैंसर की जांच करवा, भले ही आप स्वस्थ क्यों ना हो। जल्दी पहचान, कैंसर पर जीत आसान।
Thank you, Dr. Sudeep. Thank you for sharing the amazing work done by Noora Health.
Yeah. So
And thank you for those valuable, inspiring community insights. They beautifully emphasize how caregivers and communities play pivotal role in encouraging women to take charge of their health.
yeah, just to end,
I think
Dr.
my
Vandana.
voice is echoing. So if you permit, shall we move now on to the question and answer session?
Sure. Yeah, we can go further. Yeah, thank you.
So I would request all the participants to pose the question in the chat box. And there is a question for Dr. Neharika. So Dr. Neharika, how do you counsel young women about screening and vaccination without causing fear or a stigma? Over to you.
Thank you, Dr. Vanna, and thank you for such a wonderful session today. So, jab bhi, when we start counseling any young woman for any kind of vaccination, there is definitely fear. So, first thing is that we all have to be aware about this vaccine, know all the effects and side effects as doctors. Our nurses should be trained. It has to be presented like a normal health checkup with a normal vaccine. We should not start using very scary words. Use a very simple, positive language. Empower the youngsters with education and awareness so that they come to you to get vaccinated. It should not be vice versa that we are forcing them for vaccination. So जब हम उस लेवल पे पहुंच जाएंगे कि इतनी अवेयरनेस हो जाएगी कि खुद ही लोग आके वैक्सीन लगवाने लग जाएंगे, I think our sessions will be really successful.
Thanks, Dr. Neharika. The next question is for Dr. Sudeep. Dr. Sudeep, could you share one story from the field that illustrates how community-led efforts can break the silence around cancer?
Yeah, I think one of the example in our remote engagement service, like as I indicated, patients and caregivers and community members, they interact with the back-end service through WhatsApp messages. And I think this happened last month. One of the user asked about the screening questions, how to detect a cancer, particularly the cervical cancer was the question. I mean, in different language. It was in Telugu from South Indian Andhra Pradesh language. We respond in multiple languages. So it was a question, and this health information given by the nurses from our side at the first level, like go to the nearest primary health center where if you are 30 plus, you need to get into this. So after, I think 7 or 8 days, she came up with the report that she had completed, the screening thing. This is how I think one of the example, like how the support for a user or a community member, how it can help getting into the screening process. This is one of the recent example with respect to cancer screening, I could say. Yeah.
Thank you, Dr. Sudeep, for sharing the wonderful work done by India Health. And you can the next question is to Dr. Neharika. Dr. Neharika, what are the main factors contributing to the increasing incidence of cancer in India? And are there any particular lifestyle, genetic factors that are driving this trend?
So thank you, Dr. Vanna. And as I would say, it's mainly our environment and lifestyle which is showing an increasing trend of cancer in our country. First common is tobacco, alcohol and smoking. Secondly, very unhealthy diet. As you can see now, we eat a lot of processed packet foods. We don't look after our health with eating a lot of green vegetables and fruits, etc. Third, most of Indian population is either has obesity or has diabetes. And of course, fourth, late marriages and childbirth. So most of the females are focusing on their career and don't get married or have children before the age of 35, and that is also a risk factor for cancers in the later stage. Even environment, if we add our air pollution, industry exposure, chemical exposure, all these are actually added contributions towards increasing your risk over cancer.
Thank you so much, Dr. Neharika. And as the time is running fast, I'll take one more question, and that's the last question. Dr. Sudeep, to you. Caregivers often influence women's health decisions at home. How do you engage them effectively? Over to you, Dr. Sudeep.
Yeah, as I said, I think the husbands, mother-in-laws, and children, even sister-in-laws, they influence a lot in terms of decision making at the family level. So as I indicated, at the hospital level, whenever a patient comes for any of the NCD related conditions, we cover almost all NCDs together in terms of sensitizing these family caregivers. That is at one level. And at the community level, again, as I mentioned, like there are two levels of work, right? One is a hospital-based intervention, one is the community-based. At the community-based, we use the community health officers who are there for one CHO for every 3,000 populations. They reach certain outreach programs like village nutrition and health days, or certain school events or a gram sabhas, where they sensitize the male caregivers as well. So the importance of male caregivers in identification of, the cancer among women, such kind of activities, we sensitize them through engaging caregivers. I think these are the few things which had, because still this project on the community level intervention is the work in progress. I think we require to generate evidence to show how caregivers' role is actually impacting in terms of screening rates and, and the recovery rates among women as well. Yeah.
Thank you so much, Dr. Sudeep, for your wonderful insights. As we come to the end of this enlightening session, I want to sincerely thank our esteemed speakers, Dr. Shuchin, Bajaj, Dr. Neharika, Malhotra, Dr. Shalabh, Arora, Dr. Sudeep, Shetty, for their time, expertise, and commitment. Today's discussion reinforced that empowering women against cancer requires a threefold approach: dispelling myths, ensuring timely screening, and building supportive families and communities. On behalf of Ujala Cygnus Healthcare, I extend heartfelt thanks to all of you who joined us today. Together, under the vision of Swasth Nari Sashakt Parivar, let us continue working so that no woman loses her life to a disease that can be prevented or treated with early action. Thank you so much, everyone. Namaskar.